Masturbation. Solo intimacy. Self-pleasure. What's really going on with it? Is it something that benefits you? Or could it actually be behind some of the difficulties you're facing in the bedroom? I'm Dr. Rena, a urologist and pelvic surgeon. And today, I'm here to walk you through the advantages and disadvantages of masturbation, while also clearing up some of the most common myths I hear about it every day. More than 90% of men and about 75% of women say they engage in masturbation regularly, which isn't surprising at all, considering it offers many benefits beyond just pleasure. People often notice a better mood, improved sleep, and even sharper focus. And there's a reason for that. When you masturbate, your body releases several feel-good hormones like dopamine, oxytocin, serotonin, and endorphins. It's also one of the safest forms of sexual activity. Not only does it allow you to experience pleasure, but it helps you understand what stimulates you, making it easier to communicate those preferences with a partner. For some, it also provides a way to enjoy pleasure without the pressure of intimacy or performance. One of the biggest myths I often hear is that masturbation can cause blindness or lead to hairy palms, but that simply isn't true. If nearly 90% of people are masturbating, then by that logic, we'd have a world full of blind individuals and plenty of hairy palms. So clearly, that idea just doesn't hold up. Much of this belief has been spread by certain voices who view masturbation as sinful or as a sign that someone lacks control over their body. While I'm not here to challenge anyone's personal or religious beliefs, it's important to understand that these claims simply aren't based in fact. Another concern I hear all the time. People message me saying, "I masturbate every day. Am I damaging my erections? Am I hurting my chances of having a healthy sex life?" That leads us to myth number 2. Masturbation does not cause erectile dysfunction. In reality, it's often the opposite. When masturbation leads to orgasm, it activates contractions in the pelvic floor muscles. These muscles play a key role in achieving orgasm and experiencing pleasure. So, by regularly engaging and strengthening them, you may actually improve both your orgasms and your overall sexual experience. That said, there are 2 important exceptions to keep in mind. The first is pornography. There has been a noticeable rise in erectile dysfunction among younger men, and this trend appears to be linked with the increased availability of pornography. It's everywhere and easily accessible. So, what does that mean? Frequent exposure to pornography can reduce sensitivity to real-life sexual stimulation and create unrealistic expectations about what intimacy should be like. This can also introduce pressure and performance anxiety, both of which can contribute to erectile dysfunction. I see many younger patients who struggle with performance anxiety and difficulties with erections. When you really think about it, the stress of trying to perform can make it harder to achieve an erection during sex, which then increases that anxiety even more. And before you know it, you're stuck in a frustrating cycle. In fact, being able to masturbate and achieve an erection on your own can actually help build confidence. It reassures you that your body is capable, which can make a big difference when you're in a real intimate situation. The next important point to consider is guilt. If masturbation causes you to feel guilty because of your personal or religious beliefs, that can negatively affect your sexual health. In some cases, it's even been linked to anxiety and depression. Choosing not to masturbate is completely fine if it doesn't feel right for you, but if it's something you'd like to better understand or work through, speaking with a sex therapist can be helpful in addressing those feelings of guilt. Now let's talk about myth number 3. That too much masturbation reduces sensitivity. That's not entirely accurate. What can happen is this. If you consistently use a specific technique, motion, or device, your body can become pelvic, or conditioned, to that exact sensation as the way to reach orgasm. Over time, if something different is introduced, it may feel unfamiliar, making it more difficult to reach orgasm in a new or different way. So it's helpful to use techniques that are closer to what you'd experience during a real sexual encounter, or to try using less pressure or less vibration if that's not something you would typically expect during intercourse. In some cases, using a lot of pressure, intense stroking, or bending the penis in certain ways can affect sensitivity over time. And the same applies to the clitoris in women. That's why it's important to be mindful and intentional about how you approach masturbation. Now, myth number 4. Can you masturbate too much? For most people, the answer is no. Even if you're doing it daily for pleasure, relaxation, or stress relief, that's generally perfectly fine. It only becomes a concern when it starts to interfere with your everyday life. For example, if you feel a strong urge that's hard to control, or if you're avoiding normal responsibilities or even choosing masturbation over intimacy with your partner, those may be signs of overdoing it. Interestingly, while there isn't a large amount of research on this, some men who deal with chronic pelvic or testicular pain are actually advised to masturbate a few times a week as a way to relieve tension. In certain cases, it can help reduce stress and even ease ongoing discomfort. Myth number 5. If you masturbate, it means you're in a bad relationship. That's simply not true. Many people in committed relationships choose to masturbate, sometimes on their own, sometimes together, and it doesn't reflect how much love or attraction exists between partners. In fact, it can even enhance your overall sex life. It shouldn't be seen as a sign of weak intimacy or a lack of connection within a relationship. And finally, myth number 6. Masturbation lowers testosterone. There's no scientific evidence to support that. In reality, during arousal and orgasm, testosterone levels may temporarily increase, and afterward, they return to their normal range. It doesn't drain or reduce your body's overall testosterone level. This idea has been around for a long time. Even in ancient Greek and Roman cultures, men would avoid sex or masturbation before competitions, believing it would make them more aggressive or give them an advantage. Even some athletes have followed similar practices. However, there's very little scientific proof to back this up, so there's really no need to put yourself through that kind of unnecessary restriction. Thank you so much for watching, and always remember to take good care of yourself, because you truly deserve it.